Hi, good morning. I'm waiting for my ride. I just landed in Penang, so waiting for my ride to go back home for a meeting later. But I just wanted to talk about the budget because the budget was just released yesterday. Hot topic right now. Everyone's talking about it, how they can benefit from it. But one of the things that caught my eye was the VHIS, Voluntary Health Insurance Scheme. Pretty interesting. At this point, we don't really know what it is. It was sort of announced, I think, about a couple of months back, around May, that they are working on it. I think the health minister was talking about figuring it out and making it all work. So we're not clear what it is, but what we do know is 50 million has been allocated for this, and presumably I would think that they're working out either a system or it could be like a startup fund for them to come up with a pool to start a health insurance scheme. So at this moment, I think it's pretty clear that the current way healthcare is being handled, or how we help people with healthcare and government-wise, is not sustainable. That's why there's been a lot of initiatives for making people get their own insurance and make sure that they're covered, because now it's over congestion at the hospitals, and with the medical inflation being about 10 to 15% every year, it's unclear on how is it going to affect all of us, right? So this is one of the initiatives, and I think this is one of the first times, I'm not too sure, but I think this is one of the first times that the government is stepping in and doing some kind of insurance. We hear this in the States with Obamacare and all that, so governments are really concerned about making sure that healthcare is provided to the people. So the insurance associations and bodies, they have targeted for a 75% penetration rate by 2020. So 75% of Malaysians to have insurance by 2020. At this moment, we are at about less than 60%. So it sounds like a lot, right? 60% of population. Until you figure out how it's calculated, it's basically the number of policies that we have in the country, number of insurance policies in the country divided by the population. So not necessarily that we have about 60% of the people having it. It's more like because some people have like 2 or 3 policies, right? So those people kind of like add up to the number. So to put it in comparison, our neighbor Singapore, if I'm not mistaken, their penetration rate is above 300%. So above 300% means that although not everyone will have insurance, but the average is people having like 3 policies, 4 policies for their own name. So we're talking about medical, we're talking about health, we're talking about maybe income protection, all those kinds of things for each person, right? So we are quite behind in terms of that. Maybe because the awareness has not been there all this while. But we are catching up in a very big way. Even the growth in the industry, we see that it's happening quite rapidly. Even this year, they can see growth. So we don't know how this new VHIS is going to affect us, but how insurance works, or let me talk about how Takaful works, right? So it's a huge pool of funds. Pool of funds is being put in. So Takaful in a way that everyone kind of contributes to the fund, and when someone needs it, we use the money to help them. So let's say 1,000 people all put in the money, and one of them gets sick, so we take out the money and we help them, right? So that's how it works, and it doesn't work without a big fund. It doesn't work without a big pool of money, because that's how you want to balance out the risk. So if you're going to start a new fund via VHIS or a new kind of coverage scheme, it has to be a substantial amount. It has to be a lot of buy-in, but we don't know how much buy-in there will be. So that's why we see right now the bigger insurance companies, they are able to give a more competitive rates. So the plans are not the same across the board. Some companies are better at different things because that's how they figure out what risk they want and what risk they don't want, right? So that's why right now some companies are better at medical cards, some companies are better at health insurance. So it's about being competitive. So it's unclear how this is going to affect us. But personally, I feel one thing for sure, it is definitely important to take matters into our own hands. We don't know what is going to roll out, and we don't know how sustainable it's going to be, and things might change. Budgets change every year, and different things are being focused into depending on what's hot at the moment. So we need to take matters into our own hands, and it doesn't even cost a lot. Healthcare, medical card is the basic, and for someone around my age, it starts from less than $100 a month. Less than 100 ringgit a month, you can get insured. So it doesn't cost a lot, and it is up to us to take matters into our own hands to ensure that no matter what happens in terms of this kind of plans that comes out, the budget that comes out, we are secure, and it's something that we don't have to worry about. So the bigger companies, they have been around for years, close to 100 years. So in terms of stability, in terms of being able to cover for you when you need it, it's there. So be secure, start from there. I would strongly advise, if you know someone, go get advice on it, find out what is suitable for you, and see how you can start very, very quickly. You can reach out to me, you can talk to me about it if you want to. Just give me a message or text or anything, we can talk about it. But take matters into your own hands. Everyone's worried about it, the governments are worried about it, about healthcare and sustainable healthcare. So all I want to say, recap, just to kind of wrap it all up, is be prepared, plan for it right now, regardless of whatever the budget is, so that you won't be left behind. So yeah, hopefully my ride comes soon. Should be. I don't know if you guys heard all of that because it's kind of noisy here, but just a little sharing I wanted to do since I had some time. Thank you. Have a great weekend.